Yeah, trendsetter, whoa, league of my own, it don't get better. No, read what I wrote, I'm a bestseller. Yeah, reach for my goals, hit it dead center, hit it dead center. Bullseye, hit it the most, is no misses. Something like fish in a barrel, it's no different. Blindfold on me, I still got the most vision. Trendsetter, total.
Good evening, everyone. We are delighted to welcome you all to today's webinar organized by Drools in collaboration with Indian Association of Veterinary Dermatology IAVD. Thank you for taking the time to join us for this important and informative session. To begin, we invite Dr. Nagarajan to deliver the welcome address and set the stage for today's webinar. Over to Dr. Nagarajan.
Hi, good evening to everyone. On behalf of Association for Veterinary Dermatology India and our knowledge partner Drools Pet Food Drools, we invite you all for this important webinar. Important in the sense, actually, you know the topic about ringworm. So the ringworms are always having a problem of contagious nature. So the contagious and also it is a zoonotic. That's why we are given importance for this, and we wanted to give a good lecture on this to get exposed, because we have got lot of cases in our practice, but sometimes we miss because of some we won't go for some wood slump examination, or sometimes we may not go for culture. Simply we'll be treating for pyoderma or some scratching or itching allergy like that. We'll be keep on treating it, but finally it will be a fungal infection. So it is very, very important to know about the fungus in cats and dogs. Particularly in cat, it is very common, you know very well. It is particularly in the kitten, you will have more number of involvement. So that is what we wanted to stress, and it will be discussed threadbare by our expert, Dr. Jyothi from Hyderabad. She is a faculty. And I also welcome all of you to our ICVD 5 for veterinary dermatology, which is
Okay, I found this on the web for how are I-75 that Indian
So this Calcutta, ITC Bengal, Royal Bengal. So I welcome you all, and you register in advance so that you won't be having any difficulty because we are having limited seats. We won't be giving more than 600. So it is very important to register early, and welcome you all for that great event, which is done by great scientists. That is a cream of dermatology people all over the world appreciating our programs, and they are participating. The top researchers, top dermatologists of the world are contributing a lot of things for us for our development. So please utilize this, and I request our rules people to give idea about the speaker. So let them go for.
Thank you, Dr. B. Nagarajan, sir. So before we proceed, we request everyone to please fill out the form shared in the comments box to receive your certificates. So this is mandatory. Please note this is mandatory for all of you to please fill these forms to receive your certificates. So it is now a pleasure to introduce today's esteemed speaker, Dr. Jatavath Jyothi. Dr. Jyothi is currently working as Associate Professor and Head, Department of Veterinary Medicine, College of Veterinary Science, Mamnoor. She has completed 12 years of dedicated service with PVNR TVU University. She is a recipient of the INTAS Young Scientist Award for her postgraduate thesis titled Clinical and Diagnostic Aspects of Certain Common Dermatoses in Dogs with particular reference to canine atopic dermatosis. We are honored to have her with us today. We now hand over the session to Dr. Jyothi for her expert talk on spot pet ringworm and stop its spread. Sample right, confirm early and treat to cure in dogs and cats. Over to Dr. Jyothi.
Skin problems are often considered minor and ignored until they start spreading. And one such condition is ringworm, a disease that quietly spreads from one animal to another and from animals to humans without being immediately noticed. It is a highly contagious zoonotic fungal infection that affects pets, owners, veterinarians, groomers, and shelter workers. So the aim of today's webinar is not only to discuss what ringworm is and how to treat it. Let us begin by understanding the basics of ringworm, what it is, why it occurs, and how can we break the cycle of infection. So why this topic matters? So ringworm is not a just a veterinary issue. It is a zoonotic fungal disease. So ringworm is a perfect example of why human and animal health are connected. And pet ringworm is a common contagious zoonotic dermatophyte infection affecting companion animals and humans. Pet ringworm is a common contagious dermatophytic infection, and close human-animal contact and increasing pet ownership facilitates interspecies transmission and environmental persistence of dermatophyte spores. It leads to repeated exposure and reinfection. Warm, humid climatic conditions, they may favor the fungal survival and disease reoccurrence. Effective control requires an integrated One Health approach addressing animal treatment, human protection, and environmental decontamination. So, before going directly to the topic, we understand ringworm as a disease. It is briefly understand the structure of the skin, because ringworm affects only specific layers of the skin. So the skin is the largest organ of the body, all of you know, and acts as the first line of defense against physical, chemical, and microbial agents. It also plays a vital role in protection, sensation, thermoregulation, and immune defense. Anatomically, the skin is divided into three major layers. So in this picture, it is depicting that epidermis, dermis, and hypodermis. And again, the epidermis is containing different layers, and each layer has a specific structure and function, and disease involvement depends on the nature of the pathogen. And the superficial portion of the epidermis, it is called as the stratum corneum, and it consists of the dead keratinized cells. And ringworm primarily affects this keratinized layer of the epidermis because it is a keratinophilic in nature, and they produce keratinase enzymes and that allow them to digest keratin present in the stratum corneum, hair shafts, and nails. And again, in pathogenesis, we can study regarding the digestion and alopecia condition of the stratum corneum. Now coming to the difference between the human skin and dog skin. Why? Because it is a contagious and zoonotic in nature. It is important to know the difference between both the skins. So structurally, human and dog skin share the same basic layers. However, key difference affect disease susceptibility. And the epidermis in dogs is significantly thinner, that is 2 to 3 layer thickness, with fewer layers of the stratum corneum, and providing less physical barrier against fungal invasion. And the human skin is more acidic in nature and which naturally inhibits fungal growth. So whereas dog skin has a near neutral pH that favors dermatophyte survival. And again, the dog possesses a dense hair coat that retains moisture and warmth, creating a microenvironment. It is conducive to fungal proliferation. And additionally, limited sweat glands in dogs, it may reduce the natural skin cleansing compared to the humans and increasing the risk of dermatophytosis. So the epidermal turnover in case of the human skin takes place for every 28 days, and in case of the dog skin, it is 21 to 25 days. So this is the difference between the human skin and dog skin. So that's why the pet animals are more prone for the dermatophytosis compared to the human skin. And now coming to the incidence of skin diseases. So among skin diseases, the parasitic and allergic dermatitis are commonly encountered in clinical practice. So more number of the parasitic and allergic dermatitis we are noticing. And after that, the bacterial and yeast dermatitis also occur frequently, often as a secondary infections. And this fungal dermatitis, particularly dermatophytosis or ringworm, sometimes considered less severe, but it is given importance due to its contagious and zoonotic nature. So at first glance, many skin lesions look similar. So can you identify which one is ringworm in this picture? So clinically, ringworm can mimic several other dermatological conditions, including the parasitic and bacterial dermatitis. So this visual similarity is one of the main reasons ringworm is continuous to spread despite treatment. So in all these pictures, the first one is the Malassezia yeast infection, and second one is the Sarcoptes, third one is the Dermaticosis, and fourth one is the ringworm. And now coming to the distribution of the mixed infections in dogs. Also, in clinical practice, the skin lesions are rarely caused by a single pathogen. So, the most cases involve more than one etiological agent. So, the mixed infections are common in dermatological conditions because damage to the skin barrier by one pathogen, it creates an entry point for other infectious organisms. For example, dermatophyte infection causes scaling and hair loss, so which predisposes the skin to secondary bacterial colonization. So here the ringworm alone contains 50% chances of causing infection. Along with that, the ringworm and Malassezia, the mixed infection like ringworm and parasitic Demodex and Sarcoptes, and along with that, multiple infections are also possible. And in this slide, this is similar to the canines, but the cats are more prone for the dermatophytosis. It is 65% compared to the canines. And the mixed infection is also possible, especially in case of the cats. The dermatophytosis along with the secondary bacterial infection is more common compared with Malassezia and Dermaticosis Sarcoptes. And now coming to the topic. So according to the World Health Organization, the dermatophytosis is a superficial fungal infection of keratinized tissues, especially the skin, hair, and nails, caused by the dermatophyte fungi, and it belonging to the genera Trichophyton, Microsporum, and Epidermophyton. And based on their host preference and natural habitat, these dermatophytes were classified into three groups. So in this, they categorized into three groups: geophilic, zoophilic, and anthropophilic. It is very important to know regarding this distribution. Why? Because where the dermatophytes origination taken place, and which dermatophyte affect the human and animals, and which were born in the soil, and they may affect only the human or animals. So in this, the geophilic dermatophytes, they primarily live in the soil and infect animals or humans only, not both the humans and animals. And coming to the zoophilic, So zoophilic dermatophytes are adapted to animals and are the most important group in veterinary practice. When transmitted to humans, they often produce severe inflammatory lesions, highlighting their zoonotic importance. And coming to the anthropophilic, these primarily adapted to humans and usually cause chronic mild infections with minimal inflammation, and the transmission to animals is very rare. So these are the examples for the zoophilic, geophilic, and anthropophilic. So in this, the Microsporum canis, it belongs to the zoophilic and it causes the more zoonotic infectious disease condition in case of the animals. And geophilic, mostly Microsporum gypsum and Langergoni, all these things, they may causes the geophilic type of the dermatophytosis. They mostly present in the soil. And anthropophilic, coming to anthropophilic, epidermophyton flocosum, it causes the human dermatophytosis, ringworm lesions, especially circular erythematous lesions, especially by the epidermophyton flocosum. And these are the various examples of dermatophytes. They may infect the dogs, cats, rabbits, and humans. So in case of the canines and felines, mostly the organisms are same, like Microsporum canis, gypsum, and mentagrophytes. In case of the cats, apart from all these things, Microsporum distortum causes the dermatophytosis. And in case of the humans, mostly the epidermophyton flocosum and trichophyton mentagrophytes and Microsporum canis, they may cause the zoonotic infection. And now coming to the percentage incidence of the dermatophytosis, across multiple veterinary studies, the Microsporum canis consistently accounts for the majority of dermatophytosis cases in dogs and cats. And it often ranging between the 60 to 80%. And Trichophyton mentagrophytes is the second most common isolate, particularly in dogs and in cases associated with mixed infections. And coming to the factors, so the mostly the cats are highly risky compared to the canines because they also play a major role as asymptomatic carriers, particularly of Microsporum canis. And this makes cats an important reservoir of for transmission to other animals and humans. And young animals are affected more commonly than adults because of their immature immune response and incomplete development of the protective skin barriers. And coming to the gender, there is no gender predisposition has been consistently demonstrated. So it indicating that hormonal influence is minimal in dermatophytosis. So this dermatophytosis along with hypothyroidism or hyperretinocorticism cases, we will see very less in number. And certain dog breeds, particularly terriers, they appear to be more prone because of their genetic factors affecting the skin barrier function and because of the grooming behavior. And coming to the cats, especially the Persians and Himalayans, because of their long-haired breeds, often develop more severe or persistent infections. This is mostly because of the dense hair coats that retain moisture and facilitate spore adherence and make complete topical treatment and environmental decontamination. It is more challenging in case of the felines. Next, coming to the predisposing factors. So they play very much important role. So here different kinds of the predisposing factors are present, like disruption of the cutaneous barrier. So any damage to the skin surface, it facilitates dermatophyte adherence and invasion of the keratinized tissues. And high temperature and humidity favor the fungal survival and spore germination and environmental persistence. It gives the One Health concept. And impaired immature immune status, it causes the decrease in the cell-mediated immunity, especially in young or immunocompromised animals, and it increases susceptibility to infections. And deficiency in protein, zinc, and other vitamins, they may also play important role in impairing the skin integrity and immune defense mechanism. And coming to the overcrowded and unhygienic housing conditions, they play very much important role in transmission of the disease condition from animals to animal and animals to human because of infective fungal spores present. And moisture retention and poor aeration, they may create an ideal microenvironment for dermatophyte growth, and close prolonged contact with infected animals or contaminated fomites. They may cause just like grooming tools, beddings, and surface facilitates the transmission. And physiological stress-induced immunosuppression, it alters the host resistance and enable fungal colonization and persistence of the infections. So all these are the predisposing factors play a very much important role in transmission of the disease condition. And now coming to the transmission, mode of transmission. So in this, the direct contact with infected or carrier animals plays important role in transmission of the disease condition. So this direct contact with infected animal must be for a longer period. It may prone for the transmission of the disease. And indirect transmission via contaminated fomites like bedding, grooming tools, and cages also plays important role in transmission of the disease. And environmental exposures, especially the soil, and self-inoculations through scratching and grooming. And transmission is favored by skin microtrauma, moisture, overcrowding, and poor hygienic conditions. They also plays very much important role in transmission of the disease condition. And now coming to the pathogenesis, it is very much important to know where the dermatophyte starts and what type of the lesions they will produce. So this ringworm begins when infective dermatophyte spores originating from the soil, animals or humans, and come into direct contact with the skin, and these spores adhere to the keratinized layer of the skin, and they may penetrate the stratum corneum layer of the epidermis. So because this is rich in keratin, so once the organism produce keratinase enzymes, they may enable to digest keratin and use it as a nutrient source. And these enzymatic activity and fungal metabolites trigger the local inflammatory reactions, and they may resulting in redness, swelling, and increased warmth and alopecia conditions. So as the host immune response becomes active, the fungus gradually moves away from the central area of infection. That is nothing but the centrifugal manner of the infection. So this leads to central healing with peripheral expansion, and it produces the characteristic ring-shaped lesion seen in case of the dermatophytosis. So that's why the name is given as ringworm. And this picture is also depicting the pathogenesis of ringworm condition. So here also you can check how the organism enters into the skin, and first it colonizes the stratum corneum and then digests the keratin here and making the shaft brittle, and then digest keratin and making the shaft brittle, and after that spread to other hair follicle. Well, this one breaks off. So alopecia is noticed here, and these hairless ring lesions are macroscopically seen as a ringworm. And coming to the next slide, this also very much important. We have to know whether which species are ectothrics and which species are endothrix in nature. So in ectothrix infection, mostly the fungal hyphae and arthroconidia, they may develop on the surface of the surface of the hair and shaft, and destroying the cuticle and cortex from the outside, and the hair becomes fragile and breaks near the skin. And in case of the endothrix, and one more important point in case of the ectothrix, here the hair becomes fragile, and wood lamp play fluoros in case of the Microsporum canis, and common in case of the dogs and cats. In endothrix infection, the fungus invades inside the hair shaft and filling the cortex with arthroconidia, while the cuticle remains intact and the hair breaks at scalp and skin level. And here the Woods lamp fluorescence is not seen. and important in case of the human ringworm cases. And now coming to the clinical signs. So the most common clinical symptoms being hair loss, skin crust, erythema, and pruritus. So in this picture, you are noticing the erythematous circular alopecia lesions with well-defined margins and scaling and crust formation over affected areas, and erythema, broken hairs, and pruritus sometimes observed in case of the dermatophytosis, but it may aggregate with the secondary bacterial infections. So all these pictures, they are showing the dermatophytic lesions. So here the location of the lesions are also very much important, and the common locations like face, periocular area, muzzle, and ear pinna, paws, claws, and trunk region, and tail base region. All these things we can notice the ringworm lesions. So here also the picture depicting all the crusty and scaly lesions and erythematous lesions all over the body condition. Papules are also noticed in case of the secondary bacterial infection, and the similar kind of the clinical signs noticed in case of the kittens, also cats. So in this, mostly the face area is affected in case of the cats. So mostly they will spread at the base of the ear, like erythematous and alopecia in initial stages, and later they may become crusty, scaly, and more growth of the crusty lesions will be noticed in case of the cats, and they may spread from one part of the body to the other part, and they may cause severe itching in case of the kittens. And these are the various pictures depicting the various lesions of the dermatophytosis. And similar kind of the circular lesions are also noticed in case of the humans, like annular erythematous lesions with raised active borders and central clearing with peripheral scaling, well demarcated erythematous lesions, and mild to moderate pruritus and pustules, papules are also observed in case of the humans. So now coming to the topic diagnosis. Why to diagnose early? So this early diagnosis of dermatophytosis is critical not only for treatment success, but also for breaking the chain of transmission. So it is, all of you know that it is a highly contagious disease. So it spreads rapidly through direct contact and contaminated environment. Making early identification is essential to prevent the outbreaks and limit lesion severity by restricting the fungal multiplication. So the early intervention is very helpful and resulting in smaller, less inflammatory lesions, and it also reduces the environmental contamination, and prompt treatment reduces the spore shedding and thereby minimizing the environmental persistence and reinfection, and facilitates early treatment. And delayed diagnosis can lead to the persistence or reoccurrence of the dermatophytosis, especially in younger immunocompromised animals. And early control is significantly lowers the risk of severe diseases in immunocompromised pets and humans, reinforcing the One Health approach. So this is very much important slide here. Collection of the sample. So accurate diagnosis of dermatophytosis begins with proper selection and collection of the clinical samples, as poor sampling is a common cause of false negative results. And samples should be always collected from the active lesions. Why all of you know that it is in case of the active lesions, the dermatophytic microorganisms will be clearly visible in various diagnostic tests, as inactive or treated areas may not yield viable fungi. So we may get the false negative results also. And in well-defined lesions, the samples are best collected from the peripheral advancing edge, where fungal activity is highest. And when lesions are very poorly defined, in such conditions, we can go for the deep skin scrapings if we have doubt. And it is better to prefer deep skin scrapings and to obtain the adequate fungal elements. And one more important thing in collection of samples, in the dermatophytosis, the hair sample collection is very much important. So these hair samples can be collected by plucking broken or affected hairs. And from follicle, we have to take the hairs so that it gives the accurate results. And by using the McKenzie toothbrush technique, especially in case of the asymptomatic carriers, this is the McKenzie toothbrush. So in this method, the animal is brushed for 2 to 3 minutes and ensuring sufficient hair and scale material adheres to the bristles. And sometimes the nail scrapings are also helpful in diagnosis of the dermatophytosis condition. So the sample collection will be very appropriate. Samples should be taken, and it is also, all of you know that it is a centrifugal manner, so we have to take it from the peripheral area. And this slide depicting that various combination of the screening test and confirmatory methods for the diagnosis of the dermatophytosis. So this table highlighting here how each diagnostic technique differs in accuracy, speed, and practical applicability. So in this, the direct examination and Woods lamp examination, they are the screening test. They will take less time for the diagnosis of the disease condition, and they are very rapid and inexpensive. And next, coming to the microscopy and cultural examination, they are the gold standard test, but they may take long time, and it consumes time. And other tests like PCR, molecular tests like PCR, ELISA, and MALDI-TOF, and genetic analysis, they are the advanced techniques, provide high sensitivity and precise species identification. But it requires specialized facilities and cannot differentiate viable from non-viable fungi. So now coming to each diagnostic method. So the first one is the direct examination by using the dermatoscope. So this is the picture indicating dermatoscope, visualizing which part of the follicle is affected, how much area is spreading. So this dermoscopy involves using a handheld magnification tool for examining the cutaneous lesions, including the hairs and nails. And this is also a non-invasive dermoscopy, and it can be utilized for the diagnosis and monitoring infections during and after the treatment. So after giving the treatment, how much the area is recovered from the dermatophytosis and how well the treatment is working out. So this is done by the dermoscopy method, and but it requires the skills and expertise of the examiner. So the accuracy of this technique relies mostly on the skills of the person who is doing this examination. And now coming to the Woods lamp examination, everyone knows how well the Woods lamp working in diagnosis of the dermatophytosis. So all of you know that the Microsporum canis is the only species. It produces the metabolites that fluoros apple green under the UV light. So this UV light wavelength, it may range from the 320 to 400 nanometer. And the procedure must be done in the dark room, and the warm the lamp for 5 minutes, and after that you have to apply on the skin, and we have to check whether the hair is fluorescing with different colors like bluish violet, bluish green, or yellowish green. So these different colors also indicating that there is the animal is suffering with Microsporum canis, Microsporum gypsum, and other species differences. So this is very much important examination. It is also very inexpensive, and it also requires the skill. So in this, the pictures depicting the Woods lamp examination where the areas are affected with the dermatophytosis. In this picture, the animal is suffering with showing the lesions here, and at the ear eye region, and at the forehead region. So here we are noticing the lesions in the next picture, like under the Woods lamp examination, they are fluorescing with apple green and violet color, bluish violet color lesions. And in this also we are noticing the ringworm on the dorsal trunk. They are spreading, and they are fluorescing. The hair is fluorescing under the Woods lamp examination. This is also confirming that the animal is suffering with the dermatophytosis condition. And coming to the microscopic examination, that is trichogram. This is also a simple test. It is a microscopic examination of plucked hairs to evaluate the hair shaft abnormalities and fungal invasion. And this is especially useful in case of the dermatophytosis compared to other parasitic and allergic disease conditions. So the examination of the hair samples can determine if the dermatophyte species is ectothrix or endothrix. So this is very much important in differentiating both the ectothrix and endothrix dermatophytic organisms. And one more important thing, in case of the trichogram, we have to collect the hair samples, and we can use the potassium hydroxide and it applied to the hair and the skin scrapings and detect the presence of the fungal elements. And this is also very sensitive test in determining if fungi are present and can discriminate between the living and dead cells. And it cannot determine if species specific dermatophytosis. So in this also, the picture depicting that normal hair, they are normal in color, but in case of the infected hair, they are showing that there is increase in the thickness and the discoloration in the shaft of the hair. And in this also, the microscopic examination of the plucked hairs in a drop of mineral oil using the 10x objective. So normal hairs are black in color and they are thin in nature. Well, Microsporum canis infected hairs are brown and thick with cuffs of fungal spores. They are adhered to the shaft of the hair follicle. And in this, the mineral oil is another mounting medium for clinical samples with the advantage of not interfering with the fluorescent metabolites. So if the KOH not available, then go for the mineral oil and just take the hair sample and examine under the microscope. And now coming to the lactophenol cotton blue. So this is another stain that targets the chitin in fungal cell walls and enhancing the visualization of the fungal structures. And this strain kills the fungi and reducing the potential contamination of sample. So this gives that mostly the discoloration and the presence of the fungal dermatophytes in the given sample. And one more important thing, in case of the microscopic examination of LCB, mostly tape impression smear. So put a drop of the lactophenol cotton blue on a slide and take the tape and where the lesion is there, just go and stick onto that particular part, and after that removing, just attach it to the microslide and examine under the microscope. So you can see the if whether the dermatophytes are present, they may give the clear picture the animal is suffering with the dermatophytosis. And coming to the fungal culture on dermatophyte test medium. So this is a gold standard test. All of you know that. Isolating, identifying the dermatophytes from a clinical samples and grown in a culture. And nowadays, ready-made dermatophyte test mediums are available. So they contain phenol red. So that with the use of the McKenzie brush, you have to take the sample and inoculate in a culture. And after 3 to 3rd day, you can know the changes, whether the given sample is affected with the dermatophytosis. Then you can notice that change in the color. It may be red in color. And on day 8, you can confirm whether the given sample is positive for the dermatophytosis or not. So there may be complete change in the coloration. And after that, take that inoculated sample and examine under the microscope, and you will confirm whether it is because of microsporum or it may be because of the trichophyton. So, but mostly these DTM cultures, they are given the positive results for the microsporum canis. And this is also ready-made dermatophyte test medium. So in this also take the sample. So before taking the sample, wash the affected area of the skin lesions, and then proper specimen collection must be done. And after that, this specimen centrally placed in the medium surface and press into the medium to ensure the firm contact, and keep for the 3 days. And after the 3 days, you have to go for the results. So in case of the positive sample, you may get the bluish violet coloration. And this is very much important. This is an old method, the fungal culture of dermatophytes grown seborrheic dextrose agar. So based on the culture medium and based on the colonies growing, we can differentiate whether they are because of the canis, gypsum or trichophyton. So in case of the canis, mostly typically it produces the fluffy colonies and characteristic yellow-orange pigmentation. And in case of the Microsporum gypsum, it is a powdery to granular colonies and with a buff or cinnamon coloration. And in case of the Trichophyton, it is a white to cream in color and cottony colonies with the radial folds and yellowish brown in color. But we have to take care of other fungal contamination during the culture, but it takes more time for the identification of the species and for the culture of the test for the diagnosis of the dermatophytosis condition. And now coming to the advanced techniques like PCR, ELISA, and MALDI of MS. So now PCR, it is very sensitive test and it gives results very accurately. Within 2 to 3 days, we can diagnose the disease condition. And sometimes in culture, a negative PCR also it results gives the positive result if the animal is really suffering with the dermatophytosis, and it detects the dead spores in samples from the treated cats also. And coming to the ELISA, for the ELISA test have been developed to detect dermatophytes using the serum samples from the clinical cases, and we have to go for the ELISA test. It also gives accurate results by evaluation of the antibody binding to mostly to the Microsporum canis antigen. And one more test is the matrix assisted laser desorption or ionization time of flight mass spectrometry. So this is gaining popularity as a diagnostic method for detecting and identifying the fungal species. And these filamentous fungi, they may vary in phenotypes, which can be detected by changes in the protein spectra. That is nothing but the mass spectrometry method. So, well, this technique is relatively fast compared to a culture and PCR technique also. Nowadays, it is gaining importance. So in PCR, mostly the cycle threshold, it is less than 30, indicating that strongly positive for the dermatophytosis, and it is more than 40, indicating negative. And so PCR is giving very accurate levels, but cost-effective treatment. And coming to the histopathology, so it is commonly utilized technique for visualizing the fungal cells in tissues. Well, this method is rarely used for the dermatophytosis. Why? Because only the stratum corneum epidermis will be affected here. But in case any other conditions like deeply the cells are affected with this dermatophytosis, in such conditions, this histopathology plays important role in diagnosis of the disease. So in this also we know regarding the hyphae and the hair shaft affecting and discoloration and numerous micro eosinophils, macrophages and neutrophils presence. And coming to the therapy, so after proper diagnosis, once dermatophytosis is confirmed and timely and appropriate treatment becomes essential. Topical therapy. So in this, the topical two types of the therapy, topical therapy and systemic therapy. So this topical therapy forms the cornerstone of treatment, especially in mild to moderate cases, and as an adjunct to systemic therapy in case of the generalized infections if the dermatophytosis is associated with the secondary infections. And in this, the slide summarizes the commonly used topical antifungal therapies for dermatophytosis in dogs and cats, including their dosage, frequency, safety in pregnancy, and clinical remarks. So the first one is the lime sulfur dip. It is the safest and preferred option, especially in case of the pregnant cats and dogs. And azole-based shampoos like miconazole and ketoconazole, they are very effective for mild to localized infections. And combination of the shampoos with chlorhexidine, it also further reduce the spore shedding, and it is giving the environmental safe. And coming to the systemic therapy, so two types of the drugs like azoles and allylamine drugs, they are very effective for the fungal treatment. So in systemic therapy, it indicated when lesions are widespread and chronic in nature, or sometimes they are not responsible to the topical treatment. In such conditions, we can go for the systemic therapy. So in this, the itraconazole is considered the drug of choice due to its high efficacy and tissue penetration, especially in cats. It by using the pulse therapy. So pulse therapy is nothing but the first 1 week we have to go with the dosage of the 5 to 10 mg per kg body weight, and second week we have to stop the dosage, and third week again we have to start it, and fourth week again we have to stop the dose, and we have to check whether the improvement was noticed or not, or any abnormal other clinical conditions are developing, and we have to give until the treatment is noticed. Ketoconazole is a cost-effective drug and now avoided because of its teratogenic effects and risk of bone marrow suppression. And one more important thing is the terbinafine. It offers a shorter treatment course but has limited safety data in case of the pets, but it is very well giving results in case of the humans. And none of these drugs are safe during the pregnancy, and making careful case selection essential. And systemic therapy should always be combined with topical treatment to reduce environmental contamination and prevent the relapse. So these are the various medications we are giving orally and topically. And apart from this therapy, we also give the supportive therapy like hepatoprotectives. Why? Because all of you know that the most of the fungal agents, they may cause liver toxicity. So we have to go for the hepatoprotectives along with the systemic therapy and antihistamines and antioxidants like vitamin A, D, E, weekly once as injectables. And coming to the vaccination. So in our country, the vaccine is not available, but currently a few inactivated vaccinations for animal ringworm exist, and they primarily targeting the Microsporum canis. The vaccine is Funhi Canifel by different companies they are producing, and they are available in countries like Europe, North Africa, and they are used under veterinary guidance as adjuncts to treatment and outbreak control. And this vaccination must be given, it is inactivated Microsporum canis vaccine. The dose is 1 ml given through subcutaneous or intramuscular route at the age of 8 to 12 weeks. And booster dose must be given after 12 months, that is after 1 year. But if the outbreak is there, or sometimes more infection is recurring again and again, in such conditions, you go with the 10 to 14 days interval. That is, every 2 weeks, we have to give the vaccination for 2 doses. And after that, yearly once, we have to give the treatment. And coming to other treatments like photodynamic therapy and laser therapy, nowadays they are becoming very popular. And apart from that, the immunomodulatory drugs also plays very much helpful in case of the treatment of the skin dermatitis, especially the dermatophytes, because of the immunosuppression condition of the animals. So coming to the photodynamic therapy, so this is a treatment modality in which the photosensitizing agent is activated by a specific wavelength of light, and it produces the reactive oxygen species, and this ROS that destroys the fungal cells. So the photosensitizers like methylene blue, toluidine blue, or 5-amino-levulinic acid, they applied on the lesion, and the compound selectively accumulates in the fungal cells, and the area is exposed to visible light and laser light, and after that the light activation generates the ROS, and this ROS causes the oxidative damage to the fungal cell walls and membranes and leading to the fungal death. And this is a non-invasive method, and minimal systemic side effects are noticed in this condition compared to the systemic drug therapy, and effective against the drug-resistant fungi and recurrent dermatophytosis cases. And it also reduces the environmental spore load. And coming to the laser therapy, and this laser therapy mainly focused on light energy to exert antifungal, anti-inflammatory, and tissue healing effects. So it causes the direct thermal damage to the fungal cells and disruption of the fungal cell membranes and reduction of the local inflammation and improves the blood circulation and wound healing. It is a non-invasive technique and it is pain-free technique, and so short treatment is enough for the treatment of this dermatophytosis. So most recovery rates are noticed in laser therapy and photodynamic therapy. So this is also very much important. It is also gaining popularity nowadays. And coming to the immunomodulators, they are the agents that enhance or regulate the host immune response and helping the animal body to control and eliminate the dermatophyte infections more accurately. So they containing beta glucans, levamisole, interferons with a dose rate of 5 to 10 mg per kg body weight, 2.5 mg and 1000 to 10,000 international units per kg. And sometimes they may be given once daily or sometimes twice daily for 2 to 3 weeks or 3 to 4 weeks. Mostly in case of the dermatophyte infections, the treatment must be given 2 to 4 weeks so that the recurrent chances will be very less compared to 1 to 2 weeks or 1 week treatment. And now coming to ethno-veterinary medicine, and this is also nowadays becoming very famous, like traditional ethno-veterinary remedies used in the management of ringworm infections in animals because of the side effects of the topical therapy and systemic therapy of antifungal drugs. So these plant-based products such as neem, aloe vera, garlic, turmeric, and coconut oil, they possess documented antifungal, anti-inflammatory, and wound healing properties. And mostly these formulations, they may help reduce fungal load, and they may soothe the skin and promote faster lesion healing. And one more thing is apple cider vinegar. It also alters the skin pH. So mostly whenever there is alteration in the skin pH, it is creating an unfavorable environment for the dermatophyte growth. So there is a decreased chance of the dermatophyte infection. And such remedies are cost effective and easily available at home and widely practiced in rural and resource limited settings. And however, ethno-veterinary treatment should be used as a supportive or adjunct therapy rather than as a sole treatment in severe or generalized cases. So, but one drawback is scientific validation and standardization of doses remain limited, and integration with conventional antifungal therapy, it ensures better clinical outcomes and reduces the reoccurrence. And coming to the prevention, so animal level preventive measures, early detection and isolation of the affected animals to prevent the spread, regular grooming and coat inspection, and prompt treatment by using the appropriate topical and systemic or ethno-veterinary photodynamic laser therapy, and sometimes clipping of the hair around the lesions to reduce the fungal load and improve the drug penetration, and avoid overcrowding in shelters, kennels, and breeding facilities, and mostly the daily cleaning of animal living areas to remove the hair and debris, and effective disinfectants like sodium hypochlorite, anilaconazole, and accelerated hydrogen peroxide, they are used for the cleaning. They act as a sporicide, and they will prevent the environmental spore load, and vacuuming with HEPA filters to reduce the airborne spores, washing beddings, toys, and grooming tools at a high temperatures. So they also kill the spores. And human and household preventive measures, hand hygiene after handling pets, use of the gloves, avoid close contact. If we have to, within close contact also, we can clean ourselves with the disinfectants. And children's, elderly, and immunocompromised individuals should be extra cautious and educate the pet owners about the zoonotic nature of the dermatophytosis. And now coming to the conclusion. So this dermatophytosis in pet animals is a significant veterinary and public health concern due to its contagious and zoonotic nature. The successful control, it requires a multifaceted approach involving early diagnosis, appropriate antifungal therapy, strict environmental hygiene, and owner awareness. So emerging therapies such as photodynamic and laser treatments offer promising adjunct options, but should complement conventional treatment protocols. And an integrated One Health approach is essential for the effective prevention, control, and long-term management of the dermatophytosis in pets and households. And now coming to the case study. So it is a Rio suffering Rio 5 years female Labrador. It is having the severe itching and erythematous lesions on the ventral abdomen. So early diagnosis is very much important. Only the single lesion is present on the body. So on skin sample examination, it shown that positive for the Microsporum canis. And given the treatment with chlorhexidine miconazole 2% shampoos, it is a topical therapy for 2 to 3 times per week. And we noticed the recovery immediately after the 10 days. So the early diagnosis is very much important here. And coming to the other case, so it is a cat kitten, 2 months, female short-haired Desi kitten. It is also showing the dry circular patchy ringworm-like lesions on the rump and pass of the right forelimb with generalized hair loss and pruritus. And in another cat, you are also noticing the lesions around the nail. So, treated with the oral administered itraconazole syrup at a dosage of 5 mg per kg once a day for 7 days and repeated over 2 alternative weeks. So, after diagnosis, it also given the positive result for the endothrix arthrospore, that is dermatophytosis. So, and other supportive therapy like antihistamines, hepatoprotectives, and the animal recovery was noticed after 4 weeks. So early diagnosis plays very much important role, and whether we have to know it requires topical therapy or systemic therapy. So based on that, the treatment should be given, and based on that, we have to cure the animal cases. So after improvement, and finally, I sincerely thank the organizers for giving me this valuable opportunity to speak on an important One Health topic like dermatophytosis in pet animals. I am grateful to the Association for Veterinary Dermatology, India, PV, and PV Narasimha Rao Telangana Veterinary University and College of Veterinary Science, Mamnuru, and VetPro Drools. And my heartfelt thanks to the Drools for their support towards this educational initiative. And I also thank all the participants for their time, attention, and active interest. I hope this session has helped in better understanding the diagnosis, treatment, prevention, and control of ringworm and its zoonotic significance. So thank you once again.
Thank you. Thank you, Dr. Jyothi, for such an insightful and practical session. We truly appreciate you sharing your knowledge and experience with us today. Thank you so much.
You can stop sharing, Jyoti.
Okay, sir.
Okay.
So now we will move into the interactive Q&A session. Participants are requested to post their questions in the chat box for Dr. Jyothi and the IAVD panel. So if you have any questions, you please write it down in the comment section.
Good evening, madam.
Good evening, sir.
Please
Madam, you
write
told
your
that,
questions in the comment section. That will be helpful to all the audience to listen to the answers from the expert speakers.
Madam.
Yeah, before going for that, I wish you all advance a Happy New Year and also advance Happy Christmas for everyone.
Wish you the same, sir. So we have received some questions in the comment section. First one is there any indication to prescribe posaconazole for ringworm in dogs?
Actually, our treatment is based on the research, no, the evidence-based medicine. In that, we have got a very good response with the itraconazole and also terbinafine, particularly in cat. So in case of dog only, the concentration of terbinafine may not reach the expected amount in the hair follicle. So what they say is it is better to go for itraconazole in dogs. And in case of cat, both itraconazole and terbinafine will be very effective in oral medication. So whenever there is a refractory or anything problematic, then we can think of that, but we don't have much research findings in that. So as on today, they say that itraconazole is the best drug of choice for the cat and dog with the ringworm. So that is what we are following, and we are having a very good results. And we have to give importantly, we have to give 4 to 6 weeks, depending upon the severity of the condition. Both oral as well as topical will be ideal.
All right, sir. So there is one more question. How to approach treatment in liver compromised animals?
Can I explain, sir?
Yeah, please.
So in case of the immunocompromised animals, you have to first notice that regarding the based on the history and clinical signs. So whether the clinical signs they are especially limited to topical regions, then we go for the topical treatment, or sometimes we can go with the immunomodulatory drugs as I showed in the table, like beta glucans or levamisole for 2 to 3 every day we have to give. And apart from that, we can give the ethno-veterinary medicine. It also very much giving the improvement chances in case of the immunocompromised patients. So the first and important treatment is immunomodulatory drugs. They can helpful in case of the treating the dermatophytosis conditions.
We can also go for lime sulfur dip in
Yes,
those.
sir.
Yeah.
All right. So one more question from Dr. Day. Is there any particular antihistamine drug that you suggest, ma'am?
Mostly diphenhydramine, it is working very well in case of the antifungal dermatosis. So I was using that in case of the dermatophytosis cases.
All right.
So,
So what is the ideal time period for administration of systematic therapy, especially to prevent reoccurrence?
so mostly immediately after getting the diagnosis, we can go for the pulse therapy. That is on first week, we have to go with the antifungal drug, and along with the antifungal drugs, hepatoprotective drugs, and later we have to stop it. And again, third week also we can go for the antifungal drug, and later we have to stop it. So it will prevent the further reoccurrence of the treatment. And if the antifungal, there is a reoccurrence is noticed, in such conditions, go for the photodynamic therapy and laser therapy.
All right. So one more question is from Dr. Utkarsh. He's asking some examples of hepatoprotective supplements.
Hepatoprotective supplements like silimarin. Silimarin, it works very well, and we have to give depending on the body weight. If it is 10 kg body weight, we go with 3 to 5 ml per day, twice daily.
All right. So is it necessary to treat all the times with both topical and systemic antifungals for each case? Can't we go ahead with one method either topical or systemic?
To get the very effective result, it is better to go for both.
All right. So one more question is there. For systemic therapy for dermatophyte infection mixed with bacterial infection.
Sorry. Systemic infection with dermatophytes and
Dermatophyte
bacterial
infection mixed with bacterial infection. So what is the systemic therapy one should proceed with?
Okay, then we go for the ABST for that culture bacterial infection, and according to that, we go for the antibiotics along with the antifungals.
All right. Is it recommended to use topical creams such as miconazole, terbinafine, and clotrimazole, etc.?
Cats tend to lick, so it is better to avoid. It is better to use the shampoo or spray along with the oral.
And use the
All
e-collars also to prevent the licking and everything.
All right. So how many alternate weeks we should continue pulse treatment?
It
Till
is
you
up
get
to 8 weeks. 8
till you
weeks
get the result.
till
It is
the
better
therapy.
to give 6 weeks minimum. It has to be, you have to see the improvement. Even if it is going to be more than 6 weeks, if it is going to be there, you have to continue that till it gets complete cure. Complete cure means by culture, it should be negative. See, visibly you can see the improvement, but sometime by culture, it will be positive. So it is better to confirm the thing with the culture. So you take the hair, pluck the hair and send for culture, and then you see whether it is coming negative. If it is negative, then we can stop.
So there is one more question from Dr. Krishna. He is asking, is there any condition that can give false positives in wood slump?
Yes, there may be chances because of the it is associated with any mixed infections, or sometimes we are treating with the antifungal shampoos, and after that we go for the ringworm, wood slump examination in such conditions, and sometimes we are using the sulfur dip, and after that we are doing this test. In that we may get the chances of false negative.
So as on date, there is no test. It is gold standard for ringworm. But the ultimate thing is we will be seeing the culture. Culture is the very important thing. Even if you are going to have a suspicion, in spite of going for a negative in wood slab, you can very well go for culture or PCR. These two are readily available. Easily we can do. If you want to have early, morning if you give, evening you can get, that is PCR. Whereas if you are going to have, wait for some time, you can very well go for culture.
All right. So question from Dr. Juhi, how to differentiate between fungal infection and scabies in cats in both crusty lesions?
Based on the skin scraping examinations. So in skin scraping examination, we can get if the animal is positive for the scabies, we can notice that the sarcoptes or soraptes. And if it is positive for the dermatophytes, we can diagnose under the microscopy that only the fungal spores, it may be ectothrics or endothrix in nature. So based on the skin scraping examination, we can diagnose very easily, differentiate.
All right. So Dr. Sashi is asking how to approach for atopic condition along with fungal infection.
So mostly in case of the atopic dermatitis, you may rule out all the causes like parasitic, fungal, bacterial, and food allergic dermatitis, everything. Uh, Once again, ask the question.
Question was how to approach for the condition atopic dermatitis along with fungal infection, mixed infection.
Okay, so in atopic dermatitis, the 5 prominent clinical signs like erythematous lesions on the ear pinna, periocular area, commissure of the mouth, and ventral abdomen and interdistal space. But in case of the dermatophytes, especially you may notice that the alopecia erythematous lesions, they may be associated with crusty and scaly lesions. But in case of the atopic dermatitis, you may notice the prominent erythematous lesions along with the urticarial lesions. So sometimes there may be chances of fungal infection in case of the atopic dermatitis.
So we have to treat both.
All right. Shifali is asking for the brand for DTM media. Which brand to use?
Only we are using the human brands. I will find out and I will message you.
All right. So one more question from Dr. Mahendra is there. What's your opinion on topical luliconazole?
Luliconazole nowadays most recent researchers were going on the luliconazole drug. Uh, Till now we are not getting any results and treatment protocols on pet animals. In case of the humans, it is giving very good results, but it is also not a pregnant safe drug. So
All right.
researchers are going on.
One more question here. What is the suggestive treatment of dermatitis associated with hypothyroidism?
The dermatitis associated with hypothyroidism. So the first we have to go for the clinical signs like rat tail appearance and symmetric bilateral alopecia and everything in case of the hypothyroidism. And coming to the treatment, better to go with the Thyronorm or wet thyro tablets from the Vivaldi's companies. They are also available. And from Drools also, I think thyroid tablets are available. So better to give with empty stomach and check for the thyroid profile. And we have to go with thyroid tablets and along with the supportive therapy like omega fatty acids.
So 22 microgram per kg body weight you have to give daily.
All right. So is lactophenol cotton glue staining of tape impression will give accurate results in all positive cases?
Not in all positive cases, but mostly 60 to 80% of cases giving the accurate results. They are diagnosing the with lactophenol cotton blue. Mostly the dermatophytes are positive. And one more important thing is in lactophenol cotton blue, the lesion and the sample collection is very much important. So the sample must be collected from the peripheral lesion, and we have to take the just attach the tape, and we have to put for 1 to 2 minutes, and after that take the tape, and we have to put a 1 drop of the lactophenol on the microslide, and after that only you have to examine under the microscope. So for this diagnosis, mostly for the accurate results, you need accurate results. Better to collect the peripheral samples and on the crusty lesions.
All right. So among lactophenol cotton blue or by KOH microscopic method, for which one is better for ecto or endothrix?
For ecto and endothrix, it is KOH is better.
All right. Whether we can use povidone iodine topically for fungal infection so that we can also control superficial pyoderma, or whether ketoconazole is toxic for cats. These are the two separate questions.
First thing, the povidone iodine, it will irritate the skin. It will reduce the inflammation, but it will irritate the skin, and sometimes there may be chances of aggravation of the disease condition. In case of the ketoconazole topical therapy, another question.
In the recent days, as per the WCVT guidelines, WAVD guidelines, they are given meconazole is advised for the cat, not the ketoconazole. And meconazole is having better effect both in dogs and cat. That is a very important thing. It is better to avoid ketoconazole because of the toxicity in case of cat. Whereas in dog, you can use ketoconazole, but the oral is highly not recommended in case of cat. Itraconazole itself is very much effective for both. So 5 mg per kg, 5 to 10 mg per kg body weight for 6 weeks is highly effective. And there is no toxicity. We have done a study on it. It was not having any toxicity over it. If you are going to keep on giving itraconazole, it was not showing any signs of toxicity, even in kittens. Nowadays, we have got a very good syrup available in market with a minimum quantity. That is 20 mg per ml like that. So that we can very well go for it without any adverse effect.
One question from Shifali. In humans, ketoconazole and steroid shampoos are recommended lifelong as pulse therapy. Is that recommended?
No, it is not at all recommended.
And Dr. Sashi is asking best antihistamine drug for dog and cat, both.
Generally, for injectable, we are using the chlorpheniramine maleate. For tablets, we can go for the diphenhydramate.
All right. And one last question we will take. How to use lime sulfur?
So it is 1:16 dilution. 1 ml of the lime sulfur with 16 ml of the water. You have to just mix it properly, and after that you take a sponge, and after that or sometimes you can put it in a bottle and spray on the skin of the pet animal, or sometimes sponge bath is also recommended.
All right. One last question somebody has asked. Medicines for pruritus in immunocompromised animal.
She was telling already about antioxidants and other thing. So they have to
Yes.
give the antioxidants, immunomodulators, everything.
All right. So thank you so much, experts, for answering all the questions in the comments section. So we will now, to conclude today's webinar, we invite Dr. Mohanambal to deliver the vote of thanks. So over to Dr. Mohanambal.
Yeah. Good evening, Vananda. On behalf of IAVD, I express my sincere gratitude to our respected President, Dr. Nagarajan Sir, for his continuous support and guidance. I also extend my heartfelt thanks to all the IAVD members and all the participants and students. I thank the knowledge partner Drools for their continuous support, and I thank our esteemed distinguished speaker resource person Dr. Jyothi Madam for shared valuable insight on dermatophytosis. She has shared a detailed and clarity session. Thank you, ma'am. And she also shared information from skin scraping to dermoscope and lactophenol to PCR and antifungal drugs to laser therapy. Thank you so much, ma'am. I thank this opportunity to welcome you all for the ICVD 5 at ITC Royal Bengal, Kolkata on 4th to 6th June 2026. And thank you, one and all. Thank you.
Thank you so much, Dr. Mohanambal.
Thank you, Jyothi, for your great session. Very nice.
Thank you so much, sir, for giving me this opportunity.
Thank you.
I'm really thankful to you and VetPro also.
Thank you, Dr. Jyothi. So before we wrap up, a gentle reminder to please fill out the form in the comments box to receive your certificates. And thank you once again for all joining us. We look forward to your participation in our upcoming IAVD and Drools webinars. Thank you once again, one and all.
You know, my friends and I, we talk about everything under the sun. So how can we leave out discussing something as important as our pets and their diets?
Always remember to check the back of the pack when it comes to buying food for your pets.
Make sure that you're feeding only real and clean ingredients.
It is 100% real chicken.
No byproducts
or fillers.
All natural, all healthy ingredients.
It gives them the best of both, taste and nutrition.
Drools.
Drools. Drools.
Drools.
Drools.
Drools. Feed real.
Feed clean.